Welcome, everyone, and thank you for joining us today. I am Hannah Tebeka-Azriel, and I am part of Prolinium's marketing team. We are delighted to host this session on mastering facial balance with Revanesse, shape and contour. It is an honor to introduce our speaker, of course, Dr. Frank Rosengaus. Thank you for being with us.
Thank you, Hannah, for the invitation.
Dr. Rosengaus, if he needs an introduction, he doesn't need it, but I'll introduce a little bit more about him. He's a renowned facial plastic surgeon from Mexico. He's an international KOL and one of Prolinium's lead faculty experts. Dr. Rosengaus is widely recognized for his mastery of facial harmonization, his injection techniques, his ability to translate complex anatomy into practical, safe, and beautiful treatments. Before we begin, please note that this webinar is being recorded and will be available for replay shortly after the session. The presentation of Dr. Rosengaus will last approximately 45 minutes. We encourage you to ask all of your questions at any time during the presentation in the chat, and we'll gather all of the questions and address, hopefully, all of the questions at the end of the webinar. Thank you again for being with us, Dr. Rosengaus, and the floor is yours.
Thank you, Hannah, and good morning to all of you. Yes, believe it or not, it's still morning in Mexico City. And today we're going to look into how, in a wise manner, we can actually complement and combine two very nice HA products that have different properties and characteristics inside your patient's tissue in order to get very high aesthetic pleasing results that are natural. So to do that, we will go through a methodology that we have coined an acronym for it that is called beauty. So the beauty of beauty or beauty, and this signifies the following. Each letter is a step-by-step process that guarantees for you that if we do this, we follow this, we have some kind of structure, some kind of standardization that is reliable, and it's also based in science. It is anatomy sound and will allow us to have successful results in a very constant way on every patient. So let's go very fast through it so we can get to the treatment that everybody wants to see. So we start with the concept of beauty, and as you know, we always have to have this frame that is correctly, and it's not out of the box. So we have a lot of things to evaluate on that patient, but beauty is something that is difficult to define, but it's easy to understand. We need to understand not what it is exactly, but why we like what we like in our patient. And as you can see, the reason we need a method, this step-by-step process, is that everybody wants basically to copy-paste the techniques without understanding them, and that creates a high degree of failure. So if you understand the why we're doing what we're doing, that is much more interesting when you see the procedure. It's also the standardized structural process, which means that it is for everybody that comes into your office, no matter ethnicity, age, gender, etc. Corrects pre-shape perceptions. We are talking about hundreds of doctors right now hearing us. All of us are in different places of the world. We have cultural influences. We have different histories, and we need to talk the same language. We need to have these perceptions corrected according to what we have or what patients we see. Connects diverse information. Remember that not all information that we hear or see, especially today in social media, is reliable, it's correct. So fake information is very damaging. And the only way I find for this not to happen to us is to collect the information from different sources. So if we go to cadaver dissection courses, medical literature, this type of webinars or other meetings like IPCAS, then we can have a better perception of what is true. And last is a focus on holistic, safe, and natural results, like it should be. And the reason that we do this is because this is our patient. These are our daily challenges. All of you, I'm sure, sit in front of these patients and say, okay, she needs a lot of things. The process of aging has been going on for some years, but where do I start? Not only what I do, but what do I do first? So the way we assess the patient has to give us these answers. But when we have the opportunity to go through the beauty method, we get these results, which is a whole different perception of that patient. That first impression has been changed. She's not over volumized, overdone. Every part of her needs have been done slowly in this process. Like I said, it's for everybody. And also, it is patient centric. That means that we don't do this walk in, walk out clinics type of standardization that everybody leaves looking the same way. Everybody the same, but everybody different. It's all about the journey today. Remember that. You don't have to do everything on the same sitting. We take our patients through the years, and our job is not to do just one injection in one sitting. My job is to maintain the patient beautiful through those years. So when I have the opportunity to have a patient like this one that has been with me for, let's say, 16 years, you can see that I'm not promising for her to look younger. I'm just promising for her to look good for her age. And I think you can see that the skin quality, her volume, her proportions, her symmetry have been maintained, and that gives you that opportunity. Let's talk a little bit about beauty. Like I said, the understanding of beauty is, in my case, a starting point of everything. If we cannot agree on what beauty is on those patients, then we're going to have to discuss first that and then follow with the treatments. Because the only way I have found that we can have answers of what we like in those patients universally, no matter where you are in Asia, in Africa and South America, US, we have the same universal concepts of what beauty is. Then we can add to that the cultural influences. But then we talk about biology of beauty, which I define as a Darwinian aesthetics. The explanation is evolutionary. Why do we have this? Why do we don't have that? This is a way to explain beauty. Evaluation. The evaluation is central, is the central column of everything we do. That's the most valuable thing you can give to the patient is your correct diagnosis. If you go through the evaluation today, I will say that there are some 5 basic elements, but I have added 4 more. So today we have 9 elements of facial evaluation. I'm not going to go through them. This is not the talk for it, just to be aware that when we checked on that patient, we went through skin quality, symmetry, proportions, all this, including sexual dimorphism, something I called above average feature. This, at the end, gives me not only how I can contribute to beauty and attractiveness, but it also tells me what has happened in these patients through age, the signs of aging. We understand that a lot better, the discrepancies and in the appearance. An example, the first one, skin quality, number 1 priority today in the world. Yes, what do I assess? Specifically the radiance and luminosity. Inside of that concept, the hydration. I put here the contour deformities, meaning anything that needs volume is inside the light concept, not the volume concept, because I think we are over volumizing around and we need to control this volumization. Texture and structure. Okay, this is just an example. Look at the patient. It's just skin quality. She has no volume done, no toxin done, skin quality product from the Prolenium line. In this case, is a pure plus product to get rid of those lines and to give more hydration and radiancy to the skin, which was what we wanted. And when I go through the process, I can actually enhance these beautiful patients to start with. They're young. We are going through this beautification. It's not a volumization. I do different little things. The volume that I'm utilizing is very small. Let's say I decide to treat a tear trough, then the anterior midface, a lateral midface, a peripheral fossa, and at the end, the result of good, precise, accurate product location with an assessment that controls the volumization and gives you all these things that we said, symmetry, proportions, gives you patients that look like this. And this is really what the patients are looking for, considering that it's the aesthetic standard today. So aesthetics is this word. I think that beauty is encrypted, even if we do this evaluation. But in Prolenium, we are giving you some tools to solve this encryption. So you see the patient, you go through these grids, these evaluation forms where it's very binary. What does the patient need according to the area and according to that assessment? And we get some numbers at the end that tells you exactly what to do and what to do first. Now, what products? Now let's go through the utilization of the products and the tools. And I call the portfolio that we're using today in Prolenium the WYSIWYG portfolio. Why do I call it that? And so the people that don't understand what this means, maybe it's an old acronym, is what you see is what you get. And this is absolutely a differentiator of my treatments today. So like this, what is cooking in front of you and what you're putting the products in, the patient, and allowing you to actually, something very particular, predict the result is priceless. How do we do that and why? The product manufacturing process, that is something that could be very complex, but I'm just going to highlight some stuff that is happening with these particular products. The first one is number one, that I solve. And why is it interesting in this manufacturing process? Because it is actually a very high molecular weight HA. And as you know, the more similar that the HA that you are injecting is to the natural HA being produced by your body, the less probability of having immunicity problems and the less probability of having complications and swelling. So that is why this is something very important. The second one will be the wet milling process that is very proprietary of the company. And this sieving process produces actually particles of HA that have a spherical form. We know today that spheres that are uniform create less also recognition by the immune system. So it is another way to prevent ourselves to having a product that can have redness, pain, swelling. All these things are the ones that we have to avoid. Like this. Imagine putting your product and knowing that this is the form of that product, of those particles. Better biocompatibility So smooth surface, no matter what product you're using, even biostimulators, will always give you less recognition by the immune system and will be more biocompatible, less inflammation, etc. The third one, dialysis. Very few products go through a dialysis that is 7 days long. So why is that? Because we're cleaning the gel from not only BDDE and cross-linkers, but also from other type of impurities. Remember that HA today everywhere is produced by bacteria. So you can have little residual toxins from that. And this purification process lasting so much is unique, is different. So what you see is what you get means that when I apply this product, I expect, first of all, in real case studies, swelling to be very, very small. Also, water uptake. How much water the HA, which is always hydrophilic, will take differs from one product and another. And this portfolio has been, in some cases, even prehydrated, so you get very little change in volume. Last, also this is a optimized of satisfaction, meaning that you get 20% more per ml. Very nice for everybody. And that's part of the manufacturing process of why this product is a WYSIWYG. Second, is designed to meet specific needs. If we're going to sculpt beauty, I have to design a product with particular physical and chemical characteristics. So it behaves in some way in the tissue. But I can do that today. It's not about volume again. Imagine that I can think of the product as a marker or as a definer or as a lifter. I'm a lifter injector. I like to displace tissue, as you're going to see, enhancer, or just beautification, like in the lips. So each of these needs certain characteristics. We sit down, we see what is the problem, and then we design the product, not the other way around. And then you have these two products that we're going to talk about today, which are designed, this one, Contour Plus, for filling basically, but it's smoother. It's a flexible product, something that is malleable. And that depth of injection allows you to be quite superficial. So deep dermis, subcutaneous. That's the type of product when you want the product to integrate into the tissue. This is the thing. Some integrate better than others, and you think about what you want to achieve on the patient first, and then you choose the product. That's the algorithm of selection. And the second one is shape. And shape is completely different because it's designed to project and lift. It's a higher G prime product. The quantity of milligrams is the same, but this one is ideal for deep injections, supraperiosteal, and I use it as then, like I said, as a lifter. The ideal areas, temples and cheeks, basically are very, very good for contour because these are big areas that the product has to integrate and spread. But when you want definition, when you want marking, the jawline, projection, the chin, or the lateral cheeks for lifting, you use shape. These are the characteristics specifically of the rheology, but we're not going to go a lot through it. Just to know that we have the whole range of products going from the very soft products with very small G primes to very high G primes and very high lifting capacity. So the WYSIWYG in the patient, what does it get? Well, no post-treatment inflammation, excellent tissue integration, what you're reading there. Minimal water uptake, which is very difficult to achieve, is done. And it's actually the reported complication rate. And this for product selection today, I have added it because it's so hyper important. When we know that the HA products today last a lot longer than we thought, what do? Well, I take into consideration for selection that these products have to have a high sensitivity to dissolving, to hyaluronidase. And this is a comparison that my friend Julie Woodward did some a couple of years ago with 21 products. They classified a grading scale of being dissolved. And after that, they did this graph. And how does that Revanesse products are at the most sensitive part of the scale, easy to dissolve products. Let's go to the A of anatomy of beauty. We have been doing this for years, telling you about anatomy, and I love anatomy as a surgeon, and explaining it through layers, right? The 5 layers, which has been easier to describe than the anatomy, but it's not actually 100% correct and accurate. Why? Because in the face, actually, not every area of the face has 5 layers. Some have less and some have more. And when we do that, we have other issues. So today, we are fixing ourselves on using certain structures more than others and certain, therefore, layers, not in the injection plane, but what I want to achieve. And in this case, even though when we inject, we decide to inject safely, superficial or deep supraperiosteal, like I said, what I'm actually trying to do is to use the ligaments, the connective tissue, which attach the mass into the structure. These are the things I'm using in my techniques, and the ligaments are not just pinpointed, they're an area to inject. They are the ones that are holding, therefore, the mass with the muscles inside. You can see the ligaments there, but they can be osteocutaneous. They cross from bone to skin. And if they do that, they're the most useful for you because they're retaining. What do they retain? All of the soft tissue. The skin and the fat on top of it travel with the mass both in surgery and non-surgical. Always. So now what we want to do is go a little bit more complementing the layer idea with concept of movement, because we see that not taking care of movement or moving things are becoming more important, a lot more important. So you ask your patient to move, to express himself, just to see that everything is right, and the asymmetries can be seen over there also on this dynamic anatomy is what I call. And this is going to be necessary to correct some problems that we're looking at today over the use or abuse of HAs, like migration. How do we solve migration? Well, we solve it in part by looking at the dynamics of the muscles that are concentric around the mouth and the eyes principally, and looking for ways to avoid it. Well, if we are talking about dynamics, then there are 2 things for me to explain to you later in another talk, but we're looking at ligaments and spaces. One anchors the tissue, and the other one are areas for sliding the tissue to. So this allows me to move it. So tissue repositioning. Now let's go to the technique. The pyramid technique is one of the techniques we use, and this allows you to have this lifting effect that has been very controversial as a surgeon, as an injector. I am on both sides of the debate, but for me, these are lifters. It has been published here in the PRS open. You don't have to pay for it. You can go into it. It's called the jolt technique, or part of the jolt. Because these are the problems. These are the patients that are coming to my office, and look what has happened. They're squared and they have this jowl issue. So every woman at one point in her life will come and tell you that she wants this lifting, and you have to give her some kind of solution. Even surgically is very challenging. So that's mass anatomy, because that mass will be the floor of that jowl. Lateral use. Remember, in the front, the anterior midface is basically a lot of fat, a very uh, fine layer of mass. But lateral, we have a lot of connective tissue, and this one is ideal for displacement. It is attached to the zygomatic arch, not only the mass, but also the muscles, the zygomatic major and minor that you can see in this drawing. But it's because every article will tell you that the direct attachments of that mass are on the zygoma. And if we do move a little bit those ligaments of attachment, we can displace tissue. These are the attachments. These are the adhesions. This is how it looks in surgery. So look how important this is, because the ligaments don't lose their strength. As you can see, I'm pulling and it's very difficult to move it. They serve like this, like anchors of a bridge. I'm going to use the zygomatic arch ligament, and I'm going to displace the reticular ligaments from the jowl. I'm going to go like this, you're showing you from this article of surgical anatomy of the jowl. And the way I'm going to do it, I'm going to inject the air. I'm going to use a zygomatic arch as a lifting bar, but I'm going to use a special technique. I don't want volumization lateral. I don't want to increase the size of a bizygomatic distance. I'm going to use, therefore, the arch, and I'm going to put these anchors that I call them the pyramids, because most of the product will have to be based on bone, but still I'm going to have to increase the height of that mass for it to be moved. And when I do it correctly, I know this is a little bit difficult, but the green is a product that has been pre-injected, and then we did the dissection. And what you can see with those red lines is the ligaments are on top of the product. That's why they're moving. If you don't do this technique, the product will lay on top of the ligaments, which is contrary to what we want to achieve. Now, let's see the technique. This is a patient which very beautiful, rim, and she is very young, so it's not to restore anything, it's to enhance, to beautify, and we'll see how we can enhance her beauty with these techniques. As you can see on her chin, she could use a little bit more of projection, but she was concerned of the asymmetry of her chin, so we'll take care of that with a combination treatment of projection with one very strong product for targeted elevation projection and another softer product for her pre-jowl. What are these products that we're going to use? Are two. One is called Shape, very high lifting capacity. We use that in the lateral part of her midface in order to highlight the cheekbone and elevate some of the lower third tissue. So tissue repositioning is part of our goals of this treatment. And for the anterior midface, we do use a softer product called Contour. That's why it's called Contour. We are able to massage. It's a very flexible and ideal for dynamic parts of her face. So the combination of Shape and Contour will give us the result. Also here it will be deep shape on bone, as here. Superficial will have Contour just to give her a nicer shape to her chin. We're going to start with our first treatment, the treatment that is dealing with the lateral midface, and we use this part to actually reposition the tissue. We use the pyramid technique, which has been published in the PRS Open from last year. You can look for it, and it's called the jolt technique. So what are we going to do? We're going to move this mass that over here is dealing with the platysma itself that ends, as we know, in a line more closer to the tragus and the corner of her mouth, and after that there's no platysma, but the connective tissue continues and attaches itself to the zygomatic arch. So the deal is a zygomatic arch. The effect is in the lower third with this place. Then with this we can reshape her face, and for that purpose I'm going to draw for you the inferior border of that zygomatic arch. We're going to turn a little bit more your face to that left,
And with my other finger, I'm touching the superior border of that arch. Very important to go to the vascularity, danger zones of this area, but the terminal branch of the external carotid artery, the superficial temporal artery, is very easy to palpate in this area, as you can see over there. That will be my posterior border, upper, lower, posterior. And where do I start my treatments? Exactly where I finish with the natural curvature of parasygoma, which this shadowing allows me to identify, and I can see that I should start my treatments here. I put most of the product, instead of a tower, I put most of the product on bone. That's the trick. You will see the technique, and very little on skin, and that's why I'm forming there a little pyramid. That's why it's called a pyramid technique. And we can have space probably for 3 of them on this side, less on the other side. Shape. The trick is to move the tissue to make space for my product, so I use my thumb for that. As you can see, I grab the jowl, push it higher, push, 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 push until I get to that bone. A lot of bulging on top of it. I get rid of that bulging, make it a very flat area to treat. And then I support myself. I go a little bit higher than the border to avoid the transverse artery, but that one is deeper. And it's a very, very gentle introduction of the needle. It's a slow injection. I don't aspirate because I'm moving, I'm sweeping, I'm putting the product on top of the bone, slowly but surely. Not a lot of product is needed. It's a very efficient technique, and then I construct my pyramid by going out slowly, but still putting some product. So that will be my first pyramid injection. Immediately we see a better jawline, but we will continue. Same technique. I will push high, 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 all the tissue, all the way to her bone. We move the bulging, we clean. It has to be always aseptic. Don't leave a lot of space between one pyramid and the other, so we strive for evenness. And again, we get this very nice projection with not so much product, but still we're going backwards. And you will see the effect, and now we have 0.5. That means that we put 0.25 in each one. And as we go back, the bone gets smaller. The need for product also diminishes. And we touch bone. And here is where we put my last pyramid, and as I said, sweeping, not scratching the bone, going out. Now we're gonna clean. Look how far away my injection points are from the real positioning of the product. That's very curious. And normally when we do that, even though already this was her smaller side, that's why we're putting more product on this side than on the left, but this treatment allows for that side to look a little bit slimmer. And it has to be very natural, cannot project laterally. We're gonna see that effect as you sit up and we turn, and you see the highlight that is a continuous highlight all the way to her hairline, leaving a little bit of what we like shadowing, because it's a hyper-defined cheekbone. For her, it's perfect. She looks very nicely uplifted. You can see this compared to the other side that has not been treated. Now we're gonna go to the mid-face, but her mid-face is quite good in terms of volume. We just want to even out the lighting. It's a little point where you see this shadow. The shadow always tells me where to put the product in. It's gonna be deep shape Yeah, we can zoom a little bit. And then this technique allows me still to give her that very important highlighting point that some call summit or some call a malar mount, but it has to be around here, which will be the most highlighted and targeted projected part of her cheekbone. Let's do that. It's gonna be now with contour and needle. Small amounts of product. I push the tissue a little bit higher, and I do it like this because as I am doing it, I'm also reestablishing some elevation of the ligaments, especially the zygomatico-cutaneous ligament that is here. So my injection is lower than that on bone, just one injection point there. I can aspirate if needed because I'm not moving with this technique. On the other one I was. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10 seconds. I don't move and I inject slowly. How much? Around 0.2. No more than that. And that allows me to go out very slowly. Can I clean? And immediately we see the nice convexity and the opportunity for us to continue that convexity backwards to the lateral side. It's just going to be 1 point, an additional point here. How do I know that this is the right place to put it? There are many ways to do it. I like the idea of looking for the union of both the malar and zygoma. You can feel that. It's a little line, and then it's considered that 1 centimeter lateral to that is the right place for its location. Other people draw different lines to get that point in the right position. When it's a female, it has to be a high point. So that's it. I'm on bone. And again, you can aspirate. Can we see? And now we apply the product. Like always, a slow injector is a good injector. It's just a bolus, not so much product, but we need some highlighting there. And I take out the needle as softly as I can. As I went in, I go out. So now I have done the lateral, close the medial, and we can have a look of what we did again. Very natural, no over volumizing. It's not a volumization technique. It's a redistribution of the tissue technique. I could say both of them could be lifters plus highlighters, but I'm not talking about volume. Now let's go to the chin. And for the chin, remember, symmetry is very, very important. So let me draw it for you. First of all, always the jawline, the mandibular border. Where is it? Here. Her midline. Where is it? Here. And when I do that, now you see that there's more volume on the left than on the right. And I'm gonna take care by just always also taking this little shadow of the pre-jowl away. And as I do that, I'm gonna extend my treatment superficially to this side. On the right side, I can also take a little bit of that pre-jowl so we get a more even, rounded lower third that she's gonna like. Her insertion of the muscle is right here, labiomental fold, so the muscle itself has been projected before. I'm going to do a little bit extra projection. What I like is that the pogonion, the point of more projection from the side, which right now is here, to be a little bit lower. So I grab again my thumb, put it on the jawline, on the border. My other finger is on the other insertion of that muscle, and I'm gonna go deep to that muscle. Obviously, I'm gonna try to be familiar to that right side where she needs a little bit more product, and it's gonna be a deep injection supraperial. So these tissues on the chin move en bloc. They move all together, the deep fat, the muscle, the superficial fat, and the skin, all moving together like a block, forward and project. Very small amount of product. And then we're gonna contour, we're gonna reshape. Okay, so now we have much more even chin, but very small width. Now we have to extend that width, and we're gonna do it with contour with a needle on both. So we're changing the product because we're changing the depth of our injection. So put 0.4 on her. Now contour with a needle. Thank you. We want to have less of a shadow in here and here. So that is a technique that is a tower technique, but the tower technique that goes down. What do I mean? I beveled my syringe and needle. So here I'm injecting on bone very softly. I touch bone. I go down. So I'm gonna push with my tower tissue down. It's a soft product because I'm gonna put some superficially, and I want to be able to mold. This is with contour, different than shape. And you can see I corrected the shadowing on the posterior part, and now I'm gonna go forward to a little shadow left here and here. And then that's gonna be the end of the technique. Again, we inject, I touch bone very softly, go down because I'm creating this very even jawline. But with this product, I can actually mold and have very feminine, rounded jawline. And then we're gonna do the other side. I'm gonna clean the whole area, and we're gonna see what we need to do on the left side. But you're gonna see the difference between one and the other. Even if I have to draw it again. Look at that border. It's perfect. Okay, that's the border that we want, and it's much more even from the front. Now we have a little bit of a hollowness on this side that we're gonna treat the other side off camera. Now let's do a little summary of our treatment. What we did is we lifted her face, especially all the tissues in the lower third, by creating some lifting technique on the lateral part of her mid-face with the pyramid technique. We follow with just rounding it up with a little product of contour where she had some shadowing and giving her highlighting point on this side and also on the other side. But look at the effect that had on the jawline, the perfect jawline. Then we went out and did her nose, and I'm gonna show you that profile at the end, but she doesn't have the little space in between the domes, both there and in her columella. And lastly, look at her beautiful chin, symmetric, projected, not quite elongated, but according to the other jawline that you can see here. Again, very nicely seen. So yes, I'm going to ask you just to turn further as a profile with your body. Perfect. Look at that profile. So perfect 135 angle, straight dorsum, nice deep 90-degree labial nasal angle. And if I do the technique of the vertical line from the lower vermilion to her chin, it arrives just as it should. Even the rickets line will create a perfect balanced profile. This is a full profile plasty with 2 millimeters of the upper lip away and the lower lip almost touching. So look at that. Thank you very much. And now let me show you the results.
Wow. Wow.
Like?
I love how everything is so natural.
Exactly. Just a subtle touch-up.
Wow.
I'm gonna try to explain what we do so you to see the results, but basically is continuing those injections laterally. Each one is a pyramid that will sustain this mass up here, and you will get a better definition of the jawline. In the case of the chin, then we project it, as you can see, and you will see on the before and afters. We projected the chin with the shape. It's just 1 point periosteally, so it's quite simple to do and safe, even though you here have to aspirate, because we aspirate whenever we can do it correctly, meaning that we can stay on place without moving, and the technique requires for a bolus or a next amount of HA in place. If not, if the technique is about movement or it's a cannula, then we don't do that. But the idea it is that some areas require a product that is very high G prime, that it doesn't integrate a lot, that we help you out with both lifting and defining and marking and projection. And another product like Contour that we were going to use in the midface, and we were going to use lateral to the chin. So having said that, this is the before and this is the after 1 month. And even if it is after 1 month, like I said, the great advantage of these products is that you get predictability. You never get someone calling you that they're swollen, that they're red, that they have pain more on one side than the other. It's basically a product that does not create any of those complaints. So it's very nice for us. I think it's very valuable to have treatments or products that will make you safer and will make the process a little bit less cumbersome for the patient. These are the results. Look at what we achieve. So it's a lot of facial shaping. When I do the lifting and I do the projection, what I'm changing really is the shape of the face. So you can see that the face is nicer, it's more defined, angled, and that's because we have a better, higher, highly defined cheekbone, a zygoma right there, that continues smoothly the curvature, and you will see on the 3/4 and the lateral continues smoothly all the way to the nose, and then look at the chin. It's a little bit more square before, and a little bit more oval and rounded. And this has two effects. First, if you have a straight line of the jawline all the way back from the angle to the chin, it's what everybody wants. It's beautiful. It's what we are trying to achieve. And then the chin itself, other than being projected in 3D, has to look rounded because this feminizes the patient. The square chin is masculine and the oval rounded chin is feminine. So in 3/4 here, look, and you will see the balance of the profile also, but there are less shadowing on top of the jawline, more shadowing below the low line. That is definition. And then the highlighting of that cheekbone, what does it create? Remember on part of my assessment, it's light reflection. Look how I decide where the light is being reflected, and then this is what every model wants on her work, for the pictures to highlight it, to reflect light, the luminosity, but we can take care of that and we can decide where that light will be coming from, and that's the right point, and everything else has to be smooth. On the profile, we can go on, let's go from top to bottom. So in the mid face, you can see again high cheekbones, but as you remember from the frontal, there's not a huge expense of the bizygomatic distance. They don't look weird. And then we continue that with contour all the way to the anterior midface. So you can see there are no shadows. Everything has been lighted. And look at the chin, because the chin, remember, has to arrive on a vertical line from the vermilion border, the lower vermilion border. The jawline very, very well defined. And that's basically the two treatments, the combination of shape and contour. Let's go and see the other side. So these are patients that the treatments give them a subtle effect. It's not like they're going to come and everybody's going to know what they did. They're going to receive compliments of looking better or looking more beautiful, and that's it. They can avoid telling everybody what or they did. So that's good and bad, because then they don't recommend you. But look at the cheek. It's very symmetrical on both sides. The high definition jawline is very sought after in certain areas of the world, but it's very popular today, even here in South America and the US. So straight line from angle to chin, little bit more projection according to my balanced profile assessment. That's where we are achieved. More oval, smoother, and these are the effects that we want. So in resume and summary, strategy shapes the journey and the end game defines success. What we make as a diagnosis, if we know how to achieve those processes of beautification, marking, defining, lifting, etc., this is what you're going to get. Beautiful results, successful, aesthetic, pleasant results.
Thank you, Frank, for this great presentation. So here we have a question from a member of the IMCAS community. It should be appearing on the screen. Yes.
Okay, so Monica, your question is how much volume we put. I can tell you the volume that it's going to surprise you, because it's very small volume, and that's what we want. I think that today, the way to assess if one technique is better than the other might follow how much efficient that technique is. That means if I can achieve that result with less product, that might be a better technique as long as it's safe. With 1.2 mL, which is one syringe of shape, you can achieve the treatment of pyramid technique on most of the patients, meaning I divide that amount in two, 0.6 per side, And since you saw me that I put 3 pyramids, then 0.6 between 3 will give you around 0.2 mLs per point, per injection site. Now, there's not exactly that 0.2 per injection site due to one little thing. The zygomatic arch starts big and then it goes back to the temporal because part of the zygomatic arch is responsibility of that temporal bone, not of the zygomatic bone. And that one is smaller, so I put smaller products backwards a little bit more in front. So there you have the answer to that pyramid technique. It's just 0.6 per side. And then on the chin, again, very small amounts of product, around 0.3 to 0.4 mLs of shape for projection, and then around 0.6 to 0.7 divided in 2 pre-jowl areas that were treated superficially, 0.3 on one side, 0.3 on the other side. If you add all these, we're talking about 2 mLs total. Now, last thing about volume. It's all different and all patient-centric, so it depends on the patient. It might vary.
Thank you, Dr. Rosengaus. So we have a couple on other questions that I will select. Yeah, all right. How is the longevity and moldability of shape and contour?
So these are 2 questions, Pega. One is moldability and one is longevity. The moldability is product dependent. So like I explained, the contour has been designed for it, has been designed to be flexible, has been designed to be able to spread, to massage, to cover a whole area. And it's very nice because it's very even, it's very smooth. This is what you saw on the patient. And it's less on shape. On shape, you don't want that. For example, in these pyramids, I need them to stay as I am forming them. I don't want you to mold. I don't want you to push. I don't want you to massage. They have to stay there. And then we go to the longevity question. And the longevity is variable. Depending on the area that you're injecting, you're going to get longer results or not. In the case of the lateral midface, normally you will get very long-term results, meaning at least a year, I will let you know. But when the skin is very heavy, when really sustaining the jowl higher is a force of an everyday effort, you might tell your patient that she or he might come back to see you between 6 months and 1 year just to check if they need a touch-up or not on that. And for contour, depending again on the area, I will say that it is the same situation on the midface, but probably longer lasting on the chin. Any
Thank
other?
you, Frank. All right, we have another question here. I will put it on the screen. Are you placing the filler above the mass under the ligament?
No. No, as you saw on one of the dissection, the cadaver dissections that I show you with the product color green, the whole idea, imagine that this is a bone and this is a ligament, and the ligament is very close to the bone. When you push all the tissue higher, you go like this, and you have a space there between the bone and the ligament, which was what I showed you. If you put the product here, then the ligament, when you let it go, it will go like this and will stay there because the ligament is sustaining it. And that movement is what we're gaining. This is what we're actually happening with the lifting techniques. And they have to be based on ligaments. So it's obviously under the ligament, under the mass, pushing the mass higher.
Which technique do you prefer in this case, by cannula or needle, to control the zygomatic tissues?
The zygomatic tissues. This is my take, Wafa. This is my take. For me, the ligaments are precious, are hyper important. Is what I'm going to use to create the effects that you saw. So the better care of them will give you better results, right? If I use the needle, I go through them straight to the bone and then use them to lift. If you go with cannula, it's very difficult because these ligaments are actually on bone. So when you go with a cannula, you're actually damaging them. You're destroying them. You're making little holes on the ligaments that you need to get the effect. So this is not a cannula technique, even though I use a lot of cannula and the best ones are Sofil. But other than that, it's not a cannula technique in this case. Like the contour here that we couldn't see in the video, but you will see if you go back to it during the week, it's a cannula technique. It's not that I'm one or the other. I'm always have the opportunity to use both. For pyramids, needle.
For achieving optimal facial balance in the mid-face, what are the key anatomical landmarks we should focus on with a product like Shape? And how does its viscosity influence the injection technique compared to other fillers?
Okay, so remember that balance is a very wide concept word. I use balance more when I have to have something in relations to another. The basic concepts of a beautiful midface are the following: to conserve some kind of volume, because volume here in the midface is useful. It's a theory that is called neoteny. So we need that. But we don't need volumized lateral cheeks. We need high defined cheeks. And this is the essence of a beautiful midface, because it's youthful, but it's not baby-like. It's youthful, but it's very sexy, very feminine. So highlight the cheekbones and a nice contour on the anterior. So to achieve those, that's why we need two products that are ideal. The combination of the properties of both. Shape to highlight, highly defined, that's the ideal. High G prime, and that is the difference between this product and so many other products. The ability to have this high G prime with certain viscosity that even allows you for it not to be seen. And the other one will be contour.
Thank you.
Any other, can I know whether Revanesse products can be used in patients with autoimmune disease who are on remission? Kalindi. Okay, so yes, depends on the autoimmune disease. I don't know which one you're referring to and what kind of treatment they're receiving to get that remission. Are there some steroids or just immune treatments, autoimmunity treatments? But having said that, in general, this is a very low immunicity developer product. That's what I explained at the beginning. It has these characteristics that make this product to be less sensitive to this autoimmune disease than others. So if you really do need to use HA, please use this one.
Thank you. Another question here. For how long do the pyramids keep their shape upon integration with the skin?
So Renata, what we know is when we do the cadaver labs, obviously, but I think that even if the shape itself is not very well conserved, the product itself is doing that job. So I think, like I said, that the longevity of the effect of the injection is very long lasting. For me, long lasting means probably a year. So you can ask your patient to see you a little bit before that just to assess if she needs a little bit more. And she will come back and tell you, Doctor, I got the jowl again. So can you please take it up? Until today, Rana and everybody, I haven't had one patient sitting in my office that says, Dr. Rosengaus, do whatever you want, but please do not touch my jowls because I love them. This has never going to happen anywhere.
All right. Maybe your last question.
Last question.
After how much time is it recommended to repeat the procedure?
It depends on per patient. You just have to be sure that the product has gone out because you are touching now the bone. You're palpating slowly here, so you don't feel the product there. So you can redo the procedure itself, same technique, and you will get probably the same result or even better result if not all the product has been reabsorbed.
What is the needle gauge on this pre-filled syringe, and do you change it between points?
Okay, the products come with a 27 gauge needle, and this is what I use. I don't change the needle to nothing else. This allows you, remember, for the fluidity of the product is around that gauge, so it's very easy to inject it, and that's what you want. Do you change it between points? You should not need to for those 3 points, but I do change them to the other side because every time, as you know, that we touch the bone, we blunt the needle. So you have to be very, very careful. I don't use any anesthesia, as always, to touch the bone, but not to scrap, that periosteum.
Thank you, Frank. I think that we can wrap up the webinar. And thank you so much, Frank, for your amazing presentation. We have so many great comments. People are really, really happy about the webinar. Thank you so much.
You're very welcome. Bye-bye.
Bye.